Hi, welcome to Functional Fridays. I am Dr. Sherry Jacobs, and I am not with my better half today, Dr. Shannon Kennedy. She'll be back next week. I thought I would share a case study today of a patient that Dr. Kennedy and I see together. So if you get a perspective on integrative or collaborative care in a real life scenario, and you might be able to relate to this patient, a type of patient we see often. I know I certainly can relate to her. So her name is Lisa. Lisa came in to see us over a year ago, and she is in her mid-50s, complaining of not feeling very energetic, lacking motivation, a symptom that we hear often, which is wired but tired. So she'd get to the end of a day and feel completely exhausted, but when she's supposed to be sleeping, she actually feels wired instead of truly tired. So it's this combination symptom. So not getting really restful sleep. She's had some weight creep up on the past few years. It seems like no matter what she does with diet and exercise, her weight will not budge. So she's frustrated by that. She's mildly anxious throughout the day, although she doesn't really have anything to be anxious about. She's been healthy her whole life. She's been getting good medical care, been seeing a primary care physician. She was putting on, years ago, she was put on thyroid medication. So she was diagnosed hypothyroid. She's put on Synthroid many years ago. And she's not really sure at this point if Synthroid's helping her. She's not really clear why she's on it. But that was something that had come up for her in labs many years ago. Otherwise, she's showing some elevated cholesterol levels and had been prescribed a statin many different times over the years. She's got a strong family history of cardiovascular disease, but not really wanting to do a statin, not feeling like it was a good choice for her or that she was ready at her age. So just not feeling her best and wanting to know what she can do about it if there are other answers. Like many of us as we age, we just wonder sometimes too, has this never been 55 before? Maybe this is what it feels like to be 55 and I just need to accept it, or I can maybe look deeper and figure out what's going on. So we had a big intake with Lisa, and her labs that we reviewed that she had already had done. Again, they looked really good, but there were a couple things that we noticed, and one was that her TSH, which is the main feedback for the thyroid that we look at to monitor medication, it was not quite in our range. So it was in a normal range, but it was a little bit elevated for what we like, and so we suspected that she probably needed a change in thyroid dosage. We also saw her triglycerides that not out of range, but higher than we like to see, which usually indicates not either eating too many carbohydrates or not processing those carbohydrates well. And Lisa had a really good clean diet overall, so we were thinking that's probably not processing them as well as she should be, and that might be contributing to her weight gain. We also noticed her size of her red blood cells over the years had been elevated, not again just a little bit mildly out of range, nothing too concerning, but when we see those size of those red blood cells, it often points to a vitamin B12 deficiency. So we suspected that might be at play as well. We decided to go ahead and put her on a little bit of progesterone. Progesterone is a natural anxiolytic, and it helps with sleep. It just takes the edge off a little bit, and it's very safe. So we put her on a little bit of progesterone, and we added a B complex in the morning so that she could, if she was B12 deficient, that she'd get a little bit extra energy in the morning with some of those Bs. And if she wasn't, she would just urinate them out and it wouldn't be a big deal. So I wanted to do that. And then I had her tracking some of her carbohydrate levels. I find that patients, particularly my healthier patients, are getting lots of different fruits and vegetables and whole grains in, but they're not really aware of, at the end of the day, how many carbs it's adding up to. So I had her track that for us while we got a huge set of labs. So we ordered tons of different labs on her. We were looking at B12 levels, assessing her lipids in a more detailed way, looking at something called subfractions and HSCRP. We got detailed thyroid panel, we got a detailed anemia panel, a detailed B12 panel, and we looked at some hormone markers as well. We decided to get a urine hormone panel on her just to assess where she was at hormonally. So she came back probably 3 weeks later and was already feeling better. I just think she really did need those B vitamins, and she was getting better sleep, anxiety was improved, just being on the progesterone. So with her new set of labs, we saw, again, overall very healthy person. We didn't have any major concerns for her, but she did have, on her thyroid panel, she had an interesting lab marker that came up, which was her reverse T3 was a little bit elevated. So reverse T3 is actually storage form of thyroid, and when cortisol levels, stress hormones, are higher, oftentimes we'll shunt some of that thyroid hormone over to the storage form of RT3. So I think that's why she just probably wasn't getting the full benefit of thyroid medication and not really feeling the way she needed to. Her thyroid, the whole feedback system wasn't working as well as it should be. So we changed her thyroid dosage. We added a little bit of T3 and switched her to a natural thyroid hormone replacement. And we did see that she was definitely B12 deficient. We saw that both in the urine and in via blood labs. So we started her on some B12 injections so we can get them straight into the system and get her stores built up a little bit. And we saw, it was interesting on our hormone panel that we ran, her hormones are low, which we would expect somebody postmenopausal to have low hormones. We could also see though from her hormone panel how she was breaking down her hormones. So we're able to see if they were going to be we felt safe about giving her hormones, if her body was genetically metabolizing them well. That was a really good thing to see for her, and she was doing a really good job of that. And we were also able to confirm her B12 deficiency there. And the other thing that we saw was that that wired tired feeling she was having was due to some excess cortisol in the system. And that cortisol that we saw on the hormone panel correlated to why we were seeing the RT3 on the blood labs. And so the whole picture kind of came together a little bit. And certainly had to ask her more in detail about her stress levels and what might be raising her cortisol and some lifestyle things. I think she was pushing it a little bit too hard at the gym, you know, this inability to lose weight. And so she's exercising more and she's eating less, and that's causing her cortisol to increase, which is causing her thyroid to go into RT3, and her body's in a little bit of fear mode. So we had to address all of those different pieces. But Lisa's done really well with some of those minor changes. She's lost some of the weight that she needed to lose. Her energy's back, and she's sleeping really well. And she was a pretty straightforward case, and it was just nice to see all those pieces fall into line. Now, moving forward, because of her family history of cardiovascular risk factors, we ran EKG in-house. We got a detailed lipid panel on her with the subfractions, ran calcium score and a stress test. So we can get, she's healthy right now. We just want to get a baseline of all of those markers so that when we, down the road, we can always look back and catch anything that might lead to a cardiovascular issue. We want to be really preventative with that. And so hopefully she will never go down that road. And so that was something that we'll continue to track with her. And we always have the option of adding some more hormones, a little bit of testosterone or maybe estrogen, since we see that she's breaking it down really well. And she doesn't need it right now. She seems to be doing great. So we've got a little future plan for her. But yeah, I think we can all relate to her. And I think it's nice to see an integrative approach and to see all the pieces of the puzzle kind of fit together so nicely. It's not always that straightforward, not always that simple, but it certainly can be. So hope you have a happy Friday.